Well, good afternoon, everyone. We are delighted to be back with you again. This is Samaritans First International Health Forum. We're especially excited today as we have guest faculty from Liberty University today. And we're just excited to have them. Before we get started, I always just want to remind you, we're going to utilize the same format. Encourage you in the chat box to type in your name and where you're from. And at the end, we will pose questions and answers that we'll conduct through the chat box. To get started, let me open up with a word of prayer. Dear Heavenly Father, we just thank you for this day. We thank you for this forum where we can discuss medicine for the sake of the gospel. We just thank you for Dr. Klink and Dr. Wigner being with us today, and I just pray you'll speak through them. In Christ's name, amen. Well, today our topic is going to be directions in global medicine. And as I said, we have guests from Liberty University College of Osteopathic Medicine. Dr. David Klink is the director of this new global medical track at Liberty University. Dr. Klink is a board certified ophthalmologist. He trained at the National Navy Medical Center in Bethesda, Maryland. He has completed 2 fellowships in ophthalmology at the Wilmer Eye Institute at Hopkins, neuro-ophthalmology and pediatric ophthalmology. And also we have today Dr. Michael Wigner, who is board certified in emergency medicine. He trained at Penn State Hershey, where he got his medical degree, and he did his residency at York Hospital in emergency medicine. He's on he's part of the founding faculty at LUCOM. So again, we're delighted to have Dr. Klink and Dr. Wigner as they present directions in global medicine.
Great. Well, good afternoon. Thank you, Lance, very much for having us here today. We're thrilled to be able to talk to the folks about what's going on at Liberty University and the directions that we're trying to take in global medicine. Sitting next to me is Dr. Wigner. He was, as Lance said, one of the founding faculty, so he preceded me at Liberty, and he was really instrumental in setting up a lot of the things that we have that are in place right now. So I thought it was very important for him to come along and share his perspective with us. First, I want to talk a little bit about Liberty University and the College of Osteopathic Medicine. Some may not be familiar with Liberty University itself, and I'm sure that many may not be aware of the fact that we now have a medical school. I want to talk about our current medical outreach efforts, what we've done with our first and second year students, the partnership that we've developed with the World Medical Mission, and also ultimately the academic concentration that we're trying to develop. So at LUCOM, Liberty University College of Osteopathic Medicine, the planning began in 2011. Now, Liberty University is not a very old university. It was founded by the late Dr. Jerry Falwell in 1971. So it has really grown tremendously in a very short period of time. And one of his original visions was to have a multifaceted university with all of the sports and academics available everywhere else as a Christian university. Our current president is his son, Jerry Falwell Jr. And as I said, one of the main visions was to have a law school, which we have, an excellent law school, and also to have a medical school. So planning began for the medical school in 2011 with construction on our current building, which you saw on the last slide, beginning in 2013. The inaugural class came in 2014, and as I mentioned, Dr. Wigner was part of the inaugural faculty. So he was there for that. I came a year later in the summer of 2015, when I retired from the Navy. Our inaugural class graduated in 2018. We've gone through 2 matches so far with 2 classes, and have been very, very happy with the results we've gotten there. We'll talk about that briefly. So LUCOM always had a unique mission and vision. The mission LUCOM exists to educate osteopathic physicians in a Christian environment. And as you can see, it says next, LUCOM prepares physicians who dedicate themselves to excellence in osteopathic medicine through service towards their fellow man. So one of our main emphases really is service and service to the underserved. We make a lot of effort when we select our students to look for young men and women who really do have a heart for service to fit with our culture. Lifelong learning, the advancement of medical knowledge, instilling Christian values of integrity and professionalism, We try to train physicians who will provide ethical, compassionate, competent, and patient-centered osteopathic medical care. So we really are a very much of a mission and vision-driven school, and our mission and vision really is to serve the underserved. Under values, as you can see, we list scholarship, teamwork, leadership, service to professionalism, integrity, commitment to incarnational Christianity. That's very, very important to us. Diversity and the ethical treatment of peoples. Like many Christian schools, Liberty University doesn't have a faith requirement for the students who apply, for the students who we accept. I would say the majority of our students, probably 60 to 70%, are Christian because they are drawn to the school. But we have students of all faith who, if we find somebody who has the capacity, who has the heart for service, who is open to being educated in a Christian environment, we're happy to welcome them in, and ultimately we'll be happy to welcome them into the global medicine concentration. Under our goals are to develop clinical educational opportunities in rural and underserved areas of Virginia, local as well as the distant regions of the United States, and globally. So from its very founding, global medicine has been an important part of our vision. We tend to attract a lot of students who have a heart for missions and who are interested in missions medicine. So that's one of the things that we have been working towards trying to figure out progressively as the school has been established, how to best expose those students to opportunities so that they'll be encouraged and have some of the competencies and the experience to go on into full-time mission medicine. And also we see goal number 12, to develop and maintain national and international medical outreach and mission programs to train clinicians to serve, again, underserved areas in Virginia, the United States, and really throughout the whole developing world. So, as I said, we've gone through 2 matches so far in 2018. And things I want to make sure here, don't worry about all of the different numbers, but the vast majority of our students are going into primary care. We are a school that is geared towards community-based primary care. We're not a large research institution. We never will be, although we realize the importance of research, and we have several faculty who perform research and provide opportunities for students. But we really are a school that's focused on primary care, community-based practices, and serving the underserved. You'll see in the match in 2019, very similar results. The 2 large ones there, you'll see internal medicine and family medicine are the biggest ones. Now, notably, we have a fair number of students who have gone into emergency medicine. That's probably due to the influence of some of the excellent faculty we have in emergency medicine. Dr. Wigner was very instrumental in advising people for the match, and it's just maybe coincidental that we have a fair number of people go into emergency medicine. And I want everyone to notice it's hard to tease out on these charts because some of them are included under the transitional rotating internship. But of our 2 initial matches, we do have 3 in ophthalmology right now. So, good next. And this is just a breakdown of the different specialties that our students have gone into in the years. But if you take family medicine, internal medicine, peds, med peds, and women's health, we have between 60 and 70% of our students who are going into those fields. And that's really in line with our mission and vision. Mike, did you want to add anything?
No, just that it's been a really exciting process over the last couple of years to see where this is headed. So we expect these trends to continue.
Okay. So next I want to talk about what we call our Office of Clinical Collaboration and Education, OCCE. This is really our department that does all the logistics and the planning behind our medical outreach events, both domestic and internationally. As you can imagine, at a school like Liberty University, there were a lot of different majors, organizations with outreach in their name. The provost asked us to come up with a name that was unique so the folks on campus would understand exactly who we are. So this is what we came up with, the Office of Clinical Collaboration and Education, because we do. We collaborate with other organizations like World Medical Missions and other local and international organizations to provide medical care and medical education for our students. So if you look at our mission statement for the OCCE, it dedicates itself to provide medical care in underserved communities in the local area and across the world. It is our mission to reach out to communities that would normally have little to no access to medical care. So as you see from the founding of our school, from our basic mission and vision of the school to the mission and vision of the OCCE, we're very consistent. So our faculty, administrative staff, and student doctors are committed to being Christ's hands and feet in a world full of physical, emotional, and spiritual need. And I'll let you go ahead and read the rest on your own. The students, as I mentioned before, all of our students do not come from a Christian background. We welcome students of other faith. We are very clear with our students when they come in for their interviews, when they apply to the school, that we are an unapologetically Christian school, that we teach from a Christian worldview standpoint. And if we have students, as I said, who really have a heart to serve the underserved, a heart for service and interest in primary care, who want to join us and who want to receive their medical education in that environment, we welcome that. And some of those students have done really wonderful things at the school. So this is a slide that I use when I speak to the students during orientation week. We introduce the Office of Clinical Collaboration and Education, and we say, why should you participate in our medical outreach events? We talk to them about the potential benefits for a student. And these are a lot of the same things we want to nurture in the concentration. They get early clinical experience with patients. We have a fantastic standardized patient and simulation lab, which, by the way, Dr. Wigner is the person who actually set that up when the school was brand new. And the students probably have exposure with 6 to 8 standardized patients and more simulations throughout the first year. If they take our trip to Guatemala at the end of the first year, they may see, 10, 12, 15 patients the first day that they're there. So they come back much more comfortable with patients, much more able to interact, take histories, do examinations. So it really is a benefit for the students to have that early clinical experience. They may get exposure to tropical medicine or other unusual conditions that they wouldn't see back in the States. They'll develop cultural competence. That's an enormous issue in missions. We work with our different trips that we take the students on during their first 2 years with our Masters of Public Health program to teach cultural intelligence. They experience other medical systems. Many of these students have never been out of the United States. They're familiar with the medical system we have here. They see places that have different medical systems or essentially no medical systems. They have the opportunity to minister to the underserved. And for our students who are Christians, they really do have the ability to be the hands and feet of Jesus and practiced incarnational Christianity in a way that they just wouldn't have the opportunity to otherwise. So what types of events do we put on during our first 2 years to give our students exposure to underserved medicine and to understand in international medicine? So the first we call Community Care Collaborative Events, CCCs. We do one in Martinsville. It's an area in Virginia about an hour south of us. It's in what we call the tobacco region. In the southern and western parts of Virginia, there are many counties that were very instrumental in the tobacco industry in the early part of our country. There was a settlement with the tobacco industry that put a lot of money into Virginia to support education, to support businesses in those areas. In fact, they offered support. They gave us a lot of support in order to start the medical school. So one of our missions is to reach out to that area, which is a rural and underserved area. We collaborate with different community and different medical organizations. In both of these, we work with 30 plus different community organizations. Everything from the DMV and getting photographs to housing, to medical services, to social services. And we try to connect these people with the services that are available in the local area. They're typically 1 day long. They occur on Saturday. Our next one is coming up in Martinsville on November the 2nd. And we see several hundred patients. In the picture below, you can see the gymnasium and the Salvation Army in Lynchburg. The folks in the red shirt and the khaki pants are our faculty. Most of our students have on white coats. And you can see the numbers of patients that they're taking care of and connecting to different medical areas and different medical services, different social services in the area. Next. And this is just a slide of some of the activities taking place. We do have dental available at the clinics. Of course, we have eye, as you see in the upper right. We do, as an osteopathic medical school, we do osteopathic manipulative therapy. We have our faculty there. And in the bottom left, you can see one of our outstanding faculty and a couple of our students discussing medical care with a patient who came to one of the clinics. We also do international events. We do a couple different types of international trips that we'll talk about. The first is a large summer trip that we typically do right when the second semester ends at the end of May, early June. The students haven't left yet, so they can roll right from their final examinations the next day, leave for a trip. And we've done those in Guatemala. Those are about a week long with travel. They end up being about 9 days. We partner with a local medical school in the area. I will apologize, I cannot pronounce the full name in Spanish, but the acronym is CUNORI. It's a school in the Zacapa area. And we do that so that we can go to areas where their 6-year students are conducting clinics. Their medical education system is a bit different than ours. It's 6 years after high school. During their 6th year, the senior students spend time in the clinics in these towns. So these are in towns where these patients will have follow-up. So we don't believe in hit and run medicine. You want to do it in a way that will help connect these people to medical services that are available in that area and that they will receive continuing care. These are really pretty amazing events to see that many students and that many people on the ground. We frequently end up with teams, with our translators and all of our other helpers, with teams of over 100 people to go to these different villages. Below you can see kind of a typical salon in one of the villages. All the villages have these large salons. When we arrive, they usually require quite a bit of cleaning to get things in shape. And that's where we can go ahead and conduct these clinics. The next slide just shows several different pictures from the different clinics. This is another salon in the top left, and you can see patients waiting to be seen, trying to get them a little bit of shade, and some of the activities that we carry on over there. And again, all of the benefits that we had talked about before for the students, and we see there. Dr. Wooden, you've been on several of these trips. What's your perspective on these trips?
Twofold. It's a fantastic opportunity for our students to be able to interact with patients, usually for the first time, in a one-on-one environment, and then the growing relationship that we have with the local medical school and local providers just continues to amaze everyone that's involved.
Thanks, Mike, very much. Okay. All right, the second type of international trip that we do are during spring break. It's about a week long and 9-day trips, and those are primarily for our 2nd-year students. By that time, they've had more didactic work, more standardized patients. Most of these students have gone on the Guatemala trip during their first year, although that's not required. And we've gone to Honduras, Dominican Republic. In the past, we've gone to Guatemala. And these are week-long trips where they go with a physician mentor who will take 4 to 8 students. We go to existing clinics, help them with their workload, help them to see patients, but the students get more patient exposure and more one-on-one exposure with a physician. So deeper levels of clinical thinking as they're finishing up their 2nd year and as they're getting ready to roll into their 3rd year into their clinical rotations. So as I said, these are almost all students who are in the 2nd year or OMS, Osteopathic Medical Student 2 class. Okay. One of the more exciting things that we've started more recently is a partnership with World Medical Missions. The picture below, you'll see 2 of our physicians and 4 of our students over in Chogoria in Kenya. So the program started in the 2018-2019 academic year. I'm sorry, actually in the 2017-2018 academic year, and World Medical Mission sponsored 4 of our medical students to go overseas and to do 4-week clinical rotations in Samaritans Purse partner hospitals. The 2 folks who you see below, Alex and Shannon Hamilton, went over to Tenwick. They're 2 of our really spectacular students, and was a wonderful way for us to be able to kick off this partnership with 2 students of such really exceptional quality. Both of these folks want to have an interest in doing long-term international missions. Now, in 2018-2019, and now for this current 2019-2020 academic year, the program has expanded to 12 spots a year. So what we've done, we have partnerships with 2 hospitals in Kenya, both Chogoria and Tenwick. We're able to send over 4 students and 2 faculty. The students do a 4-week clinical rotation. Now we sent the faculty for the first 2 weeks of that. We did that the first time last year, to see how that worked out. And the students, when we debriefed at the end of the year, had all of our students back together, really liked doing it that way. Having the faculty there for the first 2 weeks was very important for the support, for debriefing. The students see more death and more morbidity in the first 2 days in one of these hospitals, and they've probably seen during their entire medical experience so far. So they need help processing that. They need help getting through that. They need help understanding how to function as part of the team in that hospital. Over the weekend, after the second week is completed, we have a chance to debrief, to talk to the students, to get them prepared for their last 2 weeks. And the students have said that during the last 2 weeks, they really have benefited from being able to be there without their own faculty. It forces them to become more integrated into the hospital, more integrated with the physicians and the residents and the other students who are there, and they feel more a part of what's going on there. It gives them, I think, a better feel for what long-term mission medicine is about. It is a competitive application process. It begins in May the year prior. This year, we've selected 12 students to participate in this program. We had 23 applicants. And of the 23 applicants, I think we would have felt comfortable sending virtually every one of them. So we have a strong interest in this from our students. Dr. Wigner and I were together, actually go to the next picture. Dr. Wigner and I were together last year next slide, thank you. Dr. Wigner and I were together last year at Tenwick. You can see us there in front of the sign. So Mike, give us your perspective on what the rotation was like in Tenwick. I actually got the flu shortly before I was supposed to leave, and I was delayed a week, so I only got to spend 1 week in Tenwick versus 2. Mike was there for the entire 2 weeks.
So a couple of things I want to really emphasize. The first is that the students that we're selecting are students that have self-identified as wanting to become medical missionaries, or at least heavily exploring that possibility. And what we're trying to do is create opportunities for them to explore this in a relatively safe way, and hopefully get them really excited to go into the post-residency program that World Medical Mission supports. That's our main goal. The way we've set it up is some of our students go on their own. Some of our students go with us. When they go with us, they have the opportunity to interact with us on a daily basis. Now, I was there for 2 weeks with the students. Dr. Klink came after the second week, and the students really were not with me on a day-to-day basis. They got put onto the different teams: internal medicine, peds, general surgery, OB. And then I would debrief with them in the evening. During the day, I was also working. One of the things that we are very, very respectful of is how busy our missionary physicians are in these mission hospitals. And we wanted to be able to not just ask them to take our students, but we wanted to be able to provide some actual clinical support to them. So part of what we're doing is sending our own physicians along to work. And that, I think that's a key component to this that I wanted to make sure is really emphasized. We really respect what our partner mission hospitals do, and we really respect how busy they are. So we're trying to have a symbiotic relationship, not just a hey, take our students relationship.
Yeah, and I had the chance to work in the eye clinic over at Tenwick when we were there for a week. Dr. Roberts has been there for many years, has built an amazing clinic. It is overwhelming. They have a large crush of patients. They work with the missionary ophthalmologists, but also local ophthalmologists and local residents in ophthalmology. They have surgical equipment and are able to do retinal surgeries that would rival almost any academic medical center in the United States. They really have done amazing things over there. And you see that to some of the more remote hospitals who may, and again, from my ear especially, they may have a room with a slit lamp. Okay, so all different types of capabilities over here. So we recently sat down. Our initial strategic plan ran through 2018. So as a school, we sat down and talked about our strategic plan and where we were going as a school and what we wanted to develop over the next 10 years. One of our major strategic goals, number 6, was to develop a mission pipeline. We feel very strongly at that. It's included in our strategic plan, which has been approved by our provost, approved by the board of trustees of Liberty University, and has been gone through our accrediting agency also. So Liberty University is very dedicated to this from all levels of leadership. We want to establish an educational tract to train students for medical missions. Right now, there's some programs in residency that do a really good job. Places like In His Image in Oklahoma, Mitch DeWinnick's program, where we have actually 6 students right now in their first 2 years. We're just very grateful to have them in a fantastic program like that. But in many ways, that didn't exist in a lot of medical schools. And we felt that as a Christian medical school, that was something uniquely that we should be doing. We have lofty goals. We want to make LUCOM the standard amongst medical schools that equip and propel students into medical missions, both locally, nationally, and internationally. So that's, we don't suppose that we're there yet. We don't presuppose that we're there yet, but we certainly have lofty goals, and that's where we want to go for the next. We want to equip medical leaders who will be involved medically, spiritually, administratively, culturally, logistically, and relationally. So people who will be equipped to go into missions, not just to practice medicine, but also to interact with cultures and help to promote the healthcare in different regions. We want to have the ability to recruit and share faculty nationally and internationally. As Dr. Wigner said, we send our faculty over to these different missions hospitals along with our students in order to see patients, in order to provide some relief for the folks who are over there. But we also want to enter into partnerships with people who are not necessarily at LUCOM, that we can work with them, work with our students, coordinate sending them together. And we're working on developing partnerships and expanding our existing relationship with like-minded organizations. Prime example is World Medical Missions and Samaritans Purse, where we've partnered together. For our students to be able to be funded for these trips is an amazing blessing. Many of these students wouldn't be able to go. They have large amounts of debt that have been built up through medical school. They're trying to manage their debt and figure out how they're going to work with that once they get into practice. And without this type of program, some of those students wouldn't be able to go, and some of them may not be spurred onto medical missions, as we hope that they will be. Go ahead, next. Okay. So what we want to develop is a global medicine concentration. So within academics, you have, it's not a new degree program. It's a concentration within the osteopathic medical doctor degree, the DO degree. It consists of at least 18 credit hours of work. And right now, and again, we're in development, we're in talks as far as how to best do that. I think the direction that we're going now is to have this primarily be clinical during their clinical rotations years. But the global medicine concentration supports the mission of Liberty University and the College of Osteopathic Medicine by producing physicians who will demonstrate incarnational Christianity by devoting all or a portion of their professional lives to serving the underserved, both domestically and underseas. So that's what we're trying to nurture, and we're trying to figure out how to best create an academic program that's going to support that. So we want to allow students who are interested in global medicine to obtain exposure and experience early in their medical careers. That includes during their first 2 years. We're looking at a curriculum redesign for the 3rd year, which will allow clinical rotations overseas or in domestic underserved areas. Places like Beacon Clinic in New York comes to mind is one possibility, where we would have our students rotate and have extra coursework, extra reading on underserved medicine. We hopefully that it gives some of our students unique experience, which provides a competitive edge in the residency match. For a student to be able to sit down at a residency interview and talk about the experiences that they've had in international medicine, and if it has the way that that spurred their heart to serve the underserved in many primary care residencies, I think that's going to be a big plus. We want to be able to provide a supply chain of physicians to medical mission organizations such as World Medical Mission, Samaritans Purse, and others, throughout the world. And we have lofty goals. We want to establish LUCOM as a leader in global medicine, encouraging our graduates to become leaders in global medicine for the next generation. So we don't want to just produce physicians who are going to go for a short period of time and then come back, although many may. We want to produce people who are going to make a difference in the world for the next generation. Mike, do you have any comments on that?
I think you hit it right on the head, Dave.
All right. Okay. I want to talk to you just a little bit about the process. Whenever you have to develop curriculum in an academic setting, it is a process. I was in the Navy for 28 years, was involved in residency education most of that time, but not undergraduate medical education. So I'm relatively new to the process of undergraduate medical education over the last 4.5 years or so. But just wanted to kind of make people aware of the kind of things that we're going to do to look to develop this. First thing we did to look at all of the courses of study that were offered throughout Liberty University to identify possible collaborations and overlaps. As we go on into the future, there's possibilities of other things developing, maybe dual degree programs or things like that. None of that's on the table at this point in time, but those are areas that we may look at in the future. We need to fully define our curricular requirements per the university requirements. What does a concentration require us to do? How do the courses have to be organized? How do we count those towards the degree completion plan and towards credit, and make sure that that meets all of our accreditation requirements also? We want to have lots of discussions with external partners. Again, ABWE, SIM, World Medical Missions. We've gone to the summit down in Charlotte, North Carolina recently. We are going to the Global Medical Health Conference out in Louisville. And anybody who has input for us, please, you'll have my phone number, you'll have my email at the end of the presentation. We really want people's input who've been there, who've done that, who feel that you have an idea of what we should be preparing these students to do. So please, I welcome that. Okay. And then these are just administrative steps. I have to work with our executive curriculum committee to integrate the curricular requirements into our 21-22 academic year. Again, that involves degree completion plans and credits and degree conferral requirements and all those things. We have to meet any accreditation requirements for any curricular change. If that's imposed, we hope we don't have to do major accreditation issues from that standpoint. And we want to design an entrustable professional activity-based curriculum. Entrustable professional activities are a way that's been designed by Ali ten Kaat over in the Netherlands at the University of Utrecht for evaluating students during their clinical years. It's becoming the standard by which medical students are evaluated to make sure that we're adequately preparing them to enter residency, and actually is used through residency also. I had the chance last year to attend a conference in Utrecht in the Netherlands with Dr. ten Kaat about entrustable professional activities. We plan on going back again this year and presenting the curriculum that we're designing for feedback from that group. Okay. And again, the last steps are to submit all the required documents to our school curriculum committee, get it through there and make sure we've checked all the boxes, and then submit it through the university's graduate curriculum committee to have it approved. And our hope is to launch the concentration in the 21-20 academic year. So not this coming fall, but the fall after that. So Mike, do you have any other questions on ideas about the concentration or where you see it going?
Really, what we're trying to do here, take the early work, the clinical work, and make it into a more robust experience for the students. Hopefully, to better prepare them to be medical missionaries in the future.
Yeah, and we've looked at different subject topics that we want to cover with the students. Certainly, cultural intelligence, the theological and philosophical basis of missions. There's a plethora of medical topics and public health topics that we can expose students to, probably too many to expose them to all of them, obviously, but we want to give them a foundation that they will be able to build on, and want to give them experiences that will encourage them to pursue this. Long term, my dream is to look at potential finances and how we can, possibly help these students out. That's probably a long way away at this point in time, but that's where we'd like to go.
Awesome. All right, Dr. Klink and Dr. Wigner, thank you so much for an outstanding presentation. Let me just emphasize before we address some of the questions from our listening audience. Really, I just wanted to give Liberty University an opportunity, a platform today, just to share about their new global medical concentration for their medical school. We're very excited about this global medical concentration at their medical school. Really, we see that Liberty University is really in alignment with the objectives of World Medical Mission and Samaritans Purse, and we've been delighted to participate in their medical school by providing these internship opportunities for their medical students to really prepare them to really prayerfully discern is career medical missions or international medical work. Is that something that they want to engage, with in their careers going forward? So it's just been a real pleasure to work with LUCOM and Dr. Klink and Dr. Wigner and their colleagues there, and we look forward to developing this program with them as we go forward. So just with that, just want to address a few questions that we have. Give me 1 second here. Is there a question? I can't see it there. Let's see. So, gentlemen, our first question is, does LUCOM have any vision for developing a complementary physician assistant program? I'm so sorry.
We do not currently. There's nothing in the works from that standpoint. We have an excellent physician assistant program that is being taught in town at the University of Lynchburg. We're in an area in somewhat more rural central Virginia, and we're probably bumping up against the limits of the clinical training opportunities that we have. If we were to think about doing something like that, we'd really have to look long and hard at what kind of clinical training opportunities we would have for the folks. And because there's an excellent program in town with a local university, and because of our clinical limitations, there's not any talk of that at this point.
Okay.
Great question.
Great. All right. Anybody else with questions for our guest faculty today? I don't see any in the chat box. So again, just while we're waiting, just want to thank you guys for joining us today. I did just want to mention a few other items of interest. If you did not join us, we just hosted our annual Prescription for Renewal Medical Conference. It was our 30th conference this year. Because of the size, we had over 800 persons participating. We held it at Orlando, of course, in Florida. And we had Mike Huckabee, Nikki Haley, Dr. Kent Brantley, and a number of other plenary speakers and breakout sessions. This is an annual event. Really encourage you, if you didn't participate this year, to join us next year. Again, it will be at the Orlando Renaissance in Florida. And so we're just excited to see the growth in that medical conference. And we're just excited, just to develop our medical sector and offer everyone involved just to be exposed to the different opportunities that are available. Also, just want to mention to you guys, remember the CME credit that is available for this session. The form and instructions are in your email, and we will be sending a follow-up email very shortly with a recording to this, with the recording for this presentation today. Just want to remind you too, at that same link, just to peruse our archives of the different previous recordings that you can watch for ongoing medical education. Our next presentation will be Wednesday, October the 23rd. It will be Dr. Dan Bowl, who will be presenting basic urology with limited resources. So don't see any other questions. Again, just want to conclude with saying thank you to our friends at Liberty. Great presentation today. Thanks for joining us. Have a great day. God bless.
Could I follow up with a
brief
comment?
Yes, sir.
Just from the last question, we do have a Doctor of Nursing Practitioner program at Liberty University. We have a superb nursing school at Liberty University, who a couple folks here have firsthand experience with, but really good nursing school that we do a lot of outreach together with. So we do a lot of collaborative interprofessional type educational events with our nursing school. Our director of the Office of Clinical Collaboration and Education has recently departed. We just posted the position again last week. So we are looking for somebody to join us in the position of director of the Office of Clinical Coordination and Education. It's a faculty level position, probably well suited for somebody with a background in education or medicine, public health, have had some interest so far, but that is open.
Yeah, since my daughter just graduated from the School of Nursing at Liberty, you just got me out of big trouble there. I appreciate you mentioning the excellent School of Nursing at Liberty. So excellent. I appreciate you mentioning that. Anything else before we conclude?
No, Dr. Wiggins' daughter graduated there also.
That's
So we have
right.
two folks
Absolutely.
whose daughters have graduated from an outstanding nursing school.
Exactly. All right. Well, gentlemen, thanks again. And listening audience, thank you for joining us. May God bless your day.
Thank you.
Thank you.